I didn't get to see much of it. I was running around.
Hi everyone, thank you for coming to the nursing discussion panel. My name's Laura Parcio and I'm with OhioHealth and their academic partnerships program. I'm going to send the mic over to our nurses over here to introduce themselves and how they got into nursing. Yeah.
Hi, my name is Kim. I am a clinical manager on the labor and delivery unit at Dublin Methodist Hospital. And I got into nursing because I had this drive to just help people, help them through difficult times and get them better.
Hi, I'm Julia McCraw. I'm a clinical nurse manager at Dublin as well. And I really got into nursing as silly as it sounds. My older sister is a nurse, so growing up I kind of always wanted to be like her, so she really sparked my interest.
Hi, my name is Jenny.
No, just hit it and hit it to turn it off.
Sorry. My name is Jenny. I am also a clinical manager at Dublin Methodist. I went back nursing is my second career, so I initially wanted to go to nursing school, allowed other people to sway me, I got an education degree, and then I was like, no, this isn't what I want to do. I really had a passion for helping people in that way, so then I went back and became a nurse. Thanks. Can any of you tell me the different pathways to becoming a nurse?
Sure. So there's lots of different ways to become a nurse. So we have people who go and they get their LPN first, and then they transition into RN programs. We have people who go for an associate's degree or a bachelor's degree. It just kind of depends on your preference.
What are the different types of nursing careers and the different specialties and things that are not necessarily bedside?
There are a lot of different nursing type specialties out there. There's something out there for everybody. There's the traditional, in the hospital, doing bedside nursing, labor and delivery, postpartum, med-surg, ICU, ER, that kind of stuff. There's also research, there's school nursing, there is, let me think what else is there.
You can teach.
Teaching, yes, teaching, clinicals, or at the universities in lecture halls kind of thing. What else? There's so much stuff.
Yeah, you can.
There's so much stuff. There's something there for everybody.
Yeah, you can do case management. So I always think nursing is kind of divided up into those you're either direct care or indirect care, or you're kind of working outside of the hospital. So you might be direct care working in the ED, like I said, labor and delivery, psych, inpatient, med-surg, critical care. You might still be working as a case manager or a consultant. So we also have nurses who work for oncology. So they help just our oncology patients work through what's going on with their care. And then we have everything that is kind of outside of the hospital realm. So that is, school nursing, that's in-home care, that's at a college, so whether you're teaching, and really everywhere in between.
Thanks. What would you say are the different challenges and rewards to a career in nursing?
So I'll say what they're thinking. I think the biggest reward to nursing is that you always come home feeling like you made a difference. So even in this role, I do feel like I come home making a difference, which is the biggest thing for me. I was fortunate enough to meet somebody very young on in my nursing career that he really kind of changed my perspective about how lucky I am to lead the life that I have. We were very similar in age. We were only a couple weeks apart, but he had muscular dystrophy and some other things going on, and I got the pleasure to care for him in a long stretch. And he was so grateful and so kind to me at a time when he was really going through something hard. So it just made me realize how fortunate I am to be able to do what I do and live the life that I live. And that just makes me really grateful to be able to meet people like that. And then I think some of the more challenging things is that not every day is going to be sunshine and rainbows. You're not always going to walk away from your job feeling like you checked everything off, that some days really you do feel defeated. And I know that sounds pessimistic, but I think it's part of any job. But you just have to keep your head up and go back in the next day and do your best.
Well said.
Thanks. What can a student be doing now to prepare for a career in nursing in terms of coursework or extracurricular activities?
I would say the biggest thing is focus on the math and the sciences. Take extra courses if you can in that, because nursing really is about that kind of stuff and that way of thinking. I don't know what kind of things the high schools have and stuff that can be kind of focused towards healthcare. If there's nothing specific for that, obviously pick that stuff up. If you Sometimes the hospitals will have volunteer positions that you can go and just kind of get used to a hospital, or go, talk to people, talk to people that are nurses and that kind of stuff, and just ask your questions.
Yeah, we partner with a couple of schools, Toll's being one of them. So we actually have a PSA internship position. So right now I have two 17-year-olds on my floor working in a PSA role, and they're awesome. I told one of them the other day, I was like, I feel like you were just built to be a nurse. Like, I'm so grateful she's there and getting to have these experiences. So looking into programs like that, and then if you are interested in nursing, I always suggest before you just hop into a 4-year education program to get a job in a hospital. I will put it to you how my sister told me. She said, Julia, there are just smells, and you are either going to be able to get used to them or you are not. She's like, you are going to see things that can be hard, can be challenging, and you're either going to be able to see those things and work through the rest of your shift having seen that and be able to go home and process it there, or you're not. And the best time to find out about that is before you have done a 4-year education, and then you get your first day in a hospital and you're like, this is not for me. So getting a job in a hospital, getting acclimated to what going in a room is like, and actually caring for a patient and talking to a family, because it's going to get you comfortable in the setting. And I think a lot of nursing students, they do get very uncomfortable in that setting. There's a big difference in our students that work as PSAs already, because they feel totally confident going into a room, feeding someone, bathing someone, talking to someone's family, taking vitals. Whereas students who don't, they get really focused on that aspect. And so they don't have as much focus on actually putting together the nursing pieces of it. Whereas the PSAs, they can do all of those things kind of on autopilot already. So they're really able to focus on that nursing care plan, the medications, the implications for all of those things, because they're not in the back of their mind thinking about, how are they going to talk to this family? What are they going to do when they go in the room? What are they going to talk to the patient about? They kind of have those skills down already. So I always encourage, get a job in a hospital, work as a PSA, even if it's 1 day a week, to just kind of get those skills and that experience in place.
Can you describe what a PSA does on all your floors? I think that might be helpful to everybody.
Yeah, so our PSAs, they help, they take vital signs, they perform AccuChecks, they'll do EKGs, bladder scans, they help with all the activities of daily living of our patients. So depending on how independent or not dependent the patient is, kind of depends on how much of that care they need to provide. So Do they just need to give somebody, shampoo, soap, washcloths, and get them in the shower? Or do they have to provide total care for that patient? So are they a bed bath? Do they get fed? Or are we able to set them up and they feed themselves? So our PSAs really help with all of that. And then they're always that extra set of hands. So that is where I learned a lot as a PSA, is that, so if somebody's putting in a Foley, I'll go with you, I'll hold a leg. Oh, you're doing a dressing change? Let me open everything for you and stand in there and watch. So they're always that extra set of hands for the nurse as well. So if you're wanting to learn, being that extra set of hands and just, oh, you're doing that? I've never seen that before. Let me go in. I don't know how many IVs I washed before I could even put an IV in, because you see people do it. You see their technique. You watch. You kind of get their little tips and tricks along the way, and it's really helpful.
My floor is a little bit different. In labor delivery, we don't have PSAs, but over on Mother Infant, they do. That's the postpartum side of it. But for the most part, our patients are healthy. So our PSAs do a little bit different than like on the medical floors when the patients are coming in and they're actually sick. So our PSAs do things like they help with the admission, so getting vital signs, getting the patient up for the first couple of times sometimes, to the bathroom, getting them cleaned up, making sure that the patient has the supplies that they need to care for themselves, refreshing their water, stocking rooms, tearing down rooms, setting up rooms, that kind of stuff. But for the most part, the patients are pretty self-sufficient. So there's not a whole lot that they do directly with the patient, like baths and that kind of stuff that they would do on a different floor. So a little bit different role, but the same in a lot of ways.
I work on the critical care unit, so the PSAs on our unit are kind of the opposite end of everything that they're saying. They're definitely like our eyes and ears, help with if there's an emergency situation. They're the ones that are running to get us the things that we need. They're still helping with vitals and stuff like that, but in the intensive care unit, the patients are all hooked up to heart monitors, so it's more infrequent with checking stuff like that and more like being an extra set of hands for the nurse. And I do think as far as like our PSAs and our younger people that are trying to develop into other roles, we definitely, like, if there's something going on, we're like, hey, just come in and be a set of eyes and see what's happening so that you can see it and learn from it and jump in and help if you want.
Thank you. What are the opportunities for scholarships for our tuition payments for nursing?
So I think we have really good education benefits. We do tuition reimbursement, which is pretty much applicable. I think it's like day one. I think, yeah, they're saying yeah right there. Okay. It's applicable day one. So the day you're hired, you can start using our education benefits, which is really nice. And then we do like a PCE program, which is for our final year nursing students. So they transition from a PSA into a PCE role. It does come with a little bit of a wage increase, which is nice. And then you get to do some of those skills like IVs, Foleys, non-sterile dressing changes, and practices on the units before you actually get your nursing license, which is very helpful, especially those IV skills. That's one of the things I think new graduates are the most hesitant about, is putting in an IV. So being able to do that your entire last year while you're at work is great. And then right now I know we have a bonus. So if you are here as a PCE and you stay with us as a nurse, there's a bonus tied with that. And then I am a big fan of 2-year degrees. They are less expensive. They get you to your goal sooner. So, and then they allows you to let OhioHealth pay for you to go back for your bachelor's. So in addition to the tuition reimbursement, we partner with a lot of schools for tuition reduction. And we partner with a lot of schools where your college is basically free. So in the we also do direct pay programs with certain schools. So we actually pay the school directly, so you don't have to, take out the student loan, pay the school, and then pay your loan off once we pay you after you finish your class. They pay them directly, so you don't even have to have that additional transaction or loan kind of sitting. So there's a lot, and we partner with a lot of schools. In addition to just financial things, OhioHealth does have fully functioning libraries. So a lot of students, I don't think, realize that. They are, at Riverside is the biggest one. But those librarians are amazing. If you are like, hey, I am struggling to find information on this, I'm telling you, if I message them tonight, by end of day tomorrow, they will have flooded my inbox with quality peer-reviewed articles. They will have suggested books to me or other information or other reads. We also carry a lot of books for a lot of our more popular like ADN to BSN programs, so you can actually get them from the library, use them for your course, and send them back, so you're not even buying books. So there's lots of little things like that that just make returning to school easier.
Thank you. Are there any questions from the audience?
I'll ask one as a mom. So, do you think it really matters how amazingly high ranked your college is that you go to in terms of future employment, right? So there's some programs, like of course OSU in town, they're very selective and they're top 5 nationwide. You go to OSU versus, I'll not name another school, but something that's like less competitive. Do you really think that plays out in getting hired later?
No, I started at a tech school.
Okay.
So I have a 2-year Marion Technical College degree. I graduated with no debt, and went back to get my bachelor's and my master's from Chamberlain. So I don't think it matters. And that's something I think that's very different about OhioHealth from Ohio State is they really drive wanting that bachelor's when you walk in the door.
Oh,
We
OSU
just-
hospitals does, like Wexner?
They really want that bachelor's when you walk in the door. We just want you to have it in 5 years.
So different health systems might be different in what
They are a little bit different in their expectations. But for my PSAs that are going back to a school, I tell them I don't need a 4-year degree. It's not that. That is the path for some really like that college experience.
Sure.
But if you're paying for your own college, you're doing your own things, my goal is to have you graduate with little to no debt, get you in your career path 2 years sooner. So that puts you 2 years ahead of people your own age. So most of my most of my nurses that are 2 years in are precepting, they're charged, they're getting into more of those leadership roles. So that might, and we were just talking about this, that might not mean a whole lot to an 18 or a 20-year-old, but when you're 2 years ahead and you're able to make better wages quicker in that late 20s, early 30s, it's going to mean a lot to you to have not acquired all of that student debt for a 4-year degree and then be 2 years behind the ball from folks your own age. The main thing I care about with the program that I always say is look at their NCLEX pass rate. So I don't want to say don't look at their school pass rate, but look at their first time NCLEX pass rate. So what I mean by that is if I have a school who has, the school graduates 90 to 100% of their nursing students, you're like, oh my gosh, this program's really good. And then you pull their NCLEX pass rate and it's 60%. So yeah, they graduate 100, but only 60% of them pass the NCLEX the first time.
Explain
In-
the
The NCLEX is, so that is the test you take to actually get your license.
Oh, okay.
Yeah. Versus another school may have an 80% pass rate out of their program, and you're like, wow, that's not very good. But out of those 80%, 99 of them pass their NCLEX the first time. So it's a more quality program. They're graduating 80% because their program's harder. Their standards are more challenging. So those nurses that are coming out of that program are passing that NCLEX on the first time. They're getting through the NCLEX, they're getting into the workforce, they're not getting delayed or anything like that. So look at your school's NCLEX pass rate. And I'm telling you, there are 4-year colleges that have phenomenal pass rates, and there's 4-year colleges that don't. There's 2-year colleges that do, and there's 2-year colleges that don't. And then the second thing I always look at is actual clinical hours. So does the program have a robust clinical, do they do a lot of hours? Do they have a good practicum at the end? Where the students are actually getting good one-on-one time assigned to a nurse. Or is it not very robust? Because they're not all created equal. Some programs have around 160 total clinical hours, which sounds like a lot, but it's not. When you think that all of those are not med-surg and those aren't practicum hours, so they're not time where the student is one-on-one with a nurse. And then I have students who complete over 100 just practicum hours their final semester. So when you compare just 100 practicum hours in one semester versus an entire program that's at 160, you're coming out two different quality of nurses. So look at those two things, because the cost of those schools, some of them are a lot higher for the quality of the program. And I always don't write off the tech schools. Some of our tech schools in Ohio have the best NCLEX pass rates. They have the best clinicals that I've seen. So just do your research and don't think because it has a big name it's going to be a great fit, because it might not, and they might have good other programs. They might be a really good engineering school. Doesn't mean they're a good nursing school.
Thank you.
Yeah.
That's helpful.
Any other questions?
You mentioned a 3-year degree, did I hear you right?
So depending on your education path, so like for me, I was put on a wait list when I did my school, so I technically got it in 3 years. But I did all of my prerequisites first. So like my anatomy, my physiology, all my math, all of that sort of thing, I did in the 1 year before, and then so I just did nursing classes, which also allowed me to work the entire time. So it just depends, because some of our tech schools do have wait lists, so you can be waitlisted, but that doesn't mean that you don't need to be taking classes in that time. You should be taking classes that year you're waitlisted, because you can do your nutrition. You're gonna need things like statistics for a BSN, so take it at the tech school because it's a lot cheaper. You're going to need, your AMPs, your Englishes, all of those things. So take it in that year, so then when you hit the nursing program, you're just doing the nursing classes. Some programs are accelerated 3-year BSN programs, so you can do a BSN in 3 years. Some programs, if you already have a BSN and something else, you can do an accelerated BSN for nursing in 2 years. It really just it depends. If you're an LPN, you can transition to an RN in like 18 months. It really just depends. Yeah.
Anyone else? Okay. Well, thank you all for coming. Thank you for sharing your experiences with us. Everyone have a great night.
Thank you.
Thank you.